I'm not feeling so good. Yeah, that was a hard practice. I have a terrible headache and my left arm is tingly. FAST is used to identify if someone may be having a stroke. F stands for facial droop. The right side of your face looks a little different than usual. The AA stands for arms. Are you able to raise both of your arms out directly in front of your shoulders? This showcases if someone has a right or left weakness. It appears as if your right arm is unable to stay raised at shoulder height. S stands for speech. If you are having slurred speech, the area of your brain that mechanically produces speech called the Broca's area in the frontal lobe may not be receiving adequate perfusion. Your speech is starting to slur. T stands for time. The quicker we get you to the hospital, the greater chance you have of recovering from the stroke and not needing surgical intervention. I'm going to call an ambulance. Hi James, I'm Dr. Drake. Your friend reported that you have a headache, are slurring your words and have right-sided weakness in your arm. We are going to get some blood work done as well as an ECG and CT scan to figure out what's going on with you. The paramedics took your blood glucose level in the ambulance just to rule out if your symptoms were due to abnormal blood sugars and being a diabetic.
Hi James, my name is Jordan and I am going to be your nurse for the day. Your blood work came back and we have ruled out a myocardial infarction, also known as a heart attack, and heart failure by examining your troponin levels. Your electrolytes are all within normal range, so we can rule out an imbalance causing your symptoms. Your GFR and creatinine levels are within normal range, so we can rule out any kidney function issues. Your ECG shows no abnormalities. We are going to take you down for your CT scan now.
James, your CT results shows a collection of blood pooling in your frontal lobe. This means you've had an intracranial hemorrhagic stroke. The primary causes of this type of stroke include hypertension, tumors, coagulation disorders, trauma and illicit drug use, particularly cocaine use. I do frequently use cocaine. Symptoms can occur suddenly with exercise. And I understand that you started having an intense headache after your basketball game. Individuals can also experience paralysis and dysphagia among other symptoms. Now that we have a diagnosis, we want to stop the bleeding, keep your blood pressure low with an antihypertensive, stop any medications you might be on that increase bleeding, keep the head of your bed elevated so blood can flow out of your head into the jugular vein, which will relieve pressure on your head, administer anticonvulsants to prevent seizures from happening due to pressure in your brain, and monitor your ICP. What's ICP? ICP stands for intracranial pressure, which is the pressure that is exerted by the brain, cerebrospinal fluid and blood against the inside of the skull. A normal ICP is 0 to 10.
As Dr. Drake has informed you, we will be monitoring your ICP over the next week. Therefore, I will be asking you about headaches, vomiting, and I will be monitoring your pupils, because those are all signs of an increase in ICP. I will also be completing neurovital signs and the Glasgow Coma Scale to assess your level of consciousness. We will be monitoring your blood pressure and watching for Cushing's triad, which is an increase in blood pressure with widening pulse pressure, a decrease in heart rate and slow respirations. However, this is a very late sign of increased ICP. Having the stroke at such a young age must be extremely difficult. Would you like to speak with a social worker, or do you require any support while you are in the hospital?
Yes, I would like to see a social worker.
Hi James, I am Jane and I am the occupational therapist here on the unit. My job is to provide you with exercises and practice helping you do things you could do before the stroke that you might have trouble doing now, such as cooking, eating, bathing and dressing.
My girlfriend Emily will be here soon. She is going to be primarily helping me at home.
Great, I will provide some teaching to her. Hi Emily, I'm Jane. I am the occupational therapist assigned to James. How are you doing? I'm okay. I just never thought that James would have a stroke. He's so young. Since you are going to be the primary caregiver to James, I need to provide you with some teaching before we discharge him in a few days if things remain stable. You are being discharged home today. The bleeding has resolved through reabsorption, Your blood pressure is stable and your ICP is low. Discharge planning for stroke clients includes ensuring they have a safe place to stay when they leave the hospital.
I will be returning to my home where I live with my girlfriend.
Another aspect of discharge planning includes determining what safety equipment the client will need at home. James faces the consequence of right arm paralysis due to his stroke and a facial droop. His slurring has resolved. Therefore, James will not need any aids such as a cane or walker, but he will need safety equipment in his shower. This has been arranged through Red Cross by the collaboration of a physiotherapist and occupational therapist. Another discharge consideration is identifying who will be the primary helper for the stroke client at home.
My girlfriend will be helping me at home. And she has visited lots this week in the hospital and received teaching on how to care for me at home.
We have rehabilitation set up for after you leave the hospital to help you adjust.
What will my rehabilitation feature?
You mentioned this week that you would really like some supports to deal with not being able to play professional basketball anymore, so we have provided a few options, and social work will talk with you more about those before you leave today. You have expressed a desire to stop using drugs, so the social worker will discuss the multiple options you have to try and achieve that goal.
Dr. Drake said my stroke was likely a result of my cocaine use.
After having the stroke, you are at a high risk for having another stroke, especially within the next year. You can decrease your chances of this by not using drugs, healthy eating, and activity. It is normal for a stroke survivor to feel sad over the problems caused by a stroke. However, if the sadness persists longer than 2 weeks, seek professional help. On behalf of the care team at the hospital, I wish you the best recovery possible, James.
Let's go home. I feel like I've lost myself. I can't play basketball anymore because of my stroke. I have trouble putting clothes on, cooking, and even showering. I have to relearn how to write because I am right-handed and my right arm is paralyzed. Even though I feel like I have lost so much, I am trying to recover from my stroke by attending physiotherapy, meeting with my occupational therapist to relearn skills. I am going to a psychologist to learn to cope with the loss of my passion and job as a professional basketball player, and I am attending a support group for former drug users.